So we're really close to Miami. And Miami obviously is a hot spot for cosmetic surgery, like mommy makeover, like everything. And they advertise these crazy cheap prices. So like they'll undercut everybody on price. And they're doing more of a volume game, but
hmm
they offer absolutely zero post-op care.
This is MedSpa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate Dee. Together, we explore the wild west of medicine that is the aesthetics industry. Hi, this is Dr. Kate Dee, and I am interviewing today Dr. Giselle Prado Wright. She is a MD from Florida who is the founder of Exert Body Sculpt, and she does a ton of liposuction and other body procedures. And we have not talked about liposuction on the podcast so far, and I thought it would be fantastic to be able to talk to her about her practice. So Giselle, thanks so much for coming on the podcast today.
Thanks so much for having me, Kate.
So I'm really excited to talk about this topic. I think a lot of people have questions about lipo in general, but I kind of wanted to ask you about your path to where you got there, because I think that it's pretty unique and kind of interesting. You have like just a ton of resilience to talk about. And I think that that's like really critical. We all in this industry kind of took an interesting path, right? So
Mm-hmm.
I know that you did a year of internship and then went down this path towards dermatology and then took a major pivot. So tell us a little bit about your story.
Yeah, so when I think back, it was definitely you had to have a lot of grit and resilience to go down it because, I'm very forthcoming with people. I tried to match into dermatology 3 times. So 3 years in a row from fourth year of medical school during my residency. And then again, when I was doing a research fellowship, I moved to New York City. I did a year of research up there. I published like crazy. I was really high USMLE scores. And I knew that I wanted to do derm from like first day of medical school. So I had spent a lot of time, forging connections, doing all that. And then to get that notification when you're a fourth year and all your friends, are matching and they're all happy, it sucks. Like it sucked really hard.
Yeah.
And for that to happen 3 times, I took it as there is something wrong with me and I just shouldn't be a doctor anymore because I
Ugh.
didn't even consider other specialties. I didn't think that I could do it was my dream. So I said, I'm just not going to do it. And I took a step back and I ended up getting my MBA at the University of Florida. And that really kind of laid the foundation for me of I could do something else because my entire life I just thought I was going to be a doctor, practicing physician. I didn't have any doctors in my family even to give me guidance or set an example
hmm
for me. And I kind of fell back into medicine from a mentor that I'd had in plastic surgery. And she was doing all awake lipo in her practice. She was doing injectables. She was doing a weight loss program. And she said, hey, you should come up here. You can shadow me. I'll teach you what to do. And in the beginning, it was just the med spa side. Like I never thought, 5 years ago that I would be doing so much liposuction like I'm doing now.
hmm
And it really it changed the path of my life so much that I never could have predicted it.
That's so interesting. So for anyone in the audience who doesn't know how the match works for doctors, normally when you apply for a job, you apply around, maybe you get a job offer or two or more, and then, you tell people yes or no. But that doesn't happen when doctors apply for residency. There's this national computer matching program that matches you up with one program. And it's you put in your list of all the programs in the order you would want to go there, and they put in their list of all the applicants that they would want them. and a computer matches you up. And every year there's a whole slew of people who don't actually match because of this computer program. And then once the match is over, it's kind of hard. You have to kind of scramble around. And back when I was in med school, which is ancient times now compared to you, the hardest residencies to get into were neurosurgery, derm, and radiology, which is what I ended up doing, right? And it was just really, really hard. It's super competitive. It sounds like it is just as crazy competitive as it ever was. So, but we've all gone through pivots. So for me, obviously, it was really big, from, breast cancer to aesthetics. And for you, really, you're just kind of pursuing a branch of something that you like really loved anyway, right? Although body, so you ended up learning how to do liposuction. I'm kind of curious. So how do you become an expert in liposuction? It's certainly a procedure that not only have I not ever done, but I've actually never even gone in on a case.
Hmm. Yeah, so it's something that, it's definitely a niche. A lot of plastic surgeons don't like doing liposuction because physically it's actually really taxing, and you don't know that until you do it. I used to think it was like butter, or like putting a straw into a milkshake. So when you have liposuction, you have the cannula, right? And you stick it into the fat, and the vacuum sucks it up, and
You
that's it,
suck it
right?
up.
You're just guiding the cannula. No, there's a lot of resistance.
Yeah.
So to learn to do liposuction, you have to do liposuction. And
Yeah.
that is learning the planes of the tissue, not going too superficial because that's where you're going to get your contour irregularities, not going too
Mm-hmm.
deep because that's where your muscle layer is. And if you're doing it awake, it hurts. If you're doing it asleep, you could puncture into somewhere that you don't want to be. So when I started, it was practice. I viscerally remember my mentor grabbing my hand, guiding the cannula in, and saying, "This is how you do it."
Mm-hmm. Yeah. So I'm kind of curious now. So I've talked about this and I could be just completely wrong, but my understanding is the fat in the belly is a lot easier than, say, doing like a thigh, right? Because you've got all those fibrous bands in your thigh. Is that not the
No, so
case?
an inner thigh is the easiest fat.
Well,
It
I'm kind of
is.
thinking outer thigh, but yeah. Okay.
Outer
That's
thigh, like
interesting.
saddlebag, is not super
Yeah.
easy. It kind of depends on the person. Age groups, ethnicities will change how easy it is to pull their fat. The inside of the inner thighs are probably the easiest, one of the easiest places to get too much fat. And that's where they start looking like they had a shark bite, basically, because it was too
Mm-hmm.
much. And even like the inner knee. Abdomen, depending on the person, can be easy or can be hard. Sometimes in the consultation, I see them and I say, I know this is going to be a hard one. And then other ones that I'm like, this is going to be like butter. This is good. This is easy. That's had a repeat procedure. It's a little tougher.
Mm-hmm. So how do you decide whether someone's a really great candidate for liposuction?
I do the physical exam, obviously, where I'm touching it as much as possible and I'm like feeling the thickness of it. I'm seeing what the fat distribution is. I do a lot of virtual consultations too, Kate. So with those, I look at the skin texture and like the quality of the skin and how full it is, basically. And since I've done so many cases now, I just know, virtual consultations, this person looks like, it's the pattern recognition, similar to when you are in residency, as a radiologist, they teach you this is going to be this. So that's how I do it. I touch it, and then I know I've done other cases, and this is what you're going to get.
So if you can't touch someone and you do virtual consultations in your practice?
Yeah, a lot of virtual consultations. So
Uh-huh.
we have them do like standardized photography, basically, with good lighting.
Mm-hmm.
And I usually go by the age of the person, how much the fat hangs. You can tell a lot by the hang. And
Uh-huh.
it's the same thing when you're doing, your fillers and your injectables. You know who is gonna camouflage a thick filler well, and who you're gonna be like, oh, that looks lumpy and I can see it right at the surface.
Mm-hmm. Interesting. So what kind of patients would you tell them, no, this is not a good program for you?
I'm getting a lot of patients with massive weight loss where they don't
Mm-hmm.
really have fat. It's mostly skin.
Skin.
And
Uh-huh.
a weight loss patient is not going to get as good skin retraction as a person that has good, thick fat.
Mm-hmm.
So, depending on the person's expectations, I have turned those away. They're also tougher to do, honestly. There's a lot of patients that they had massive weight loss and they want to get fat transfer because, everything gets deflated. So they're taking fat
Mm-hmm.
from the areas they don't want, putting it elsewhere. That fat that's left behind, it just has so much like thicker connective tissue around it. It's like those juicy fat globules just
Mm-hmm.
aren't there nearly as much.
Interesting. So, are you also doing weight loss with GLP-1 agonists in your practice?
Yeah, definitely. We started, when I started, the GLP-1s weren't really an option because you couldn't get it compounded and it was
Yeah.
just cost prohibitive. And we were doing the regular, phentermine with Topamax, everything
Mm,
generic. But yeah, since the compounding became available, we've been doing it now maybe 2 or 3 years where the
yeah.
medications are like shipped directly to the patients. So we see it both ways. We see patients that come from the weight loss program and then they lose some weight and they want to get lipo, and then I get patients that come for lipo, and I offer them a free month of the weight loss program to like maintain their results. It also makes them look a little bit better if they lose some weight. Yeah, I've seen it both ways.
So that's really interesting. So if somebody has not done either of those things, is there an ideal sequence to do? Would you lose a little weight and then do lipo and then finish it off with more GLP-1 agonists, or is it better to do one thing than the other? Obviously, it's not good to get skinny and then get the last little bit of fat out with lipo. That sounds like that's not the best option.
It depends on the expectations of the patient, Kate. So
Mm,
you have patients that they come in and they're like so discouraged because they're going to the gym, they're trying to lose weight, and they're not seeing the shape in the mirror that they feel like they work so hard for. So
mm-hmm,
liposuction is there for so quick. In two
mm-hmm.
weeks, you're going to look so much better. Your fat distribution looks better. And even if you keep losing weight after that, like the shape is there. And then there's the ones that, I already lost 50 pounds, but my shape is not what I wanted. My boob is gone, my butt is gone. And it depends on the person.
Right. Well, I think it sounds like a really great combination program, really.
To
So
do both,
depending on
yes.
what your goal is to do both. So, ideally, go see Giselle in Florida if you're in Florida. Well, I recently lost 20 pounds on terzepatide. And of course that might be going away. I don't know. It's so confusing as to what's going to
They
be
change their
really.
minds every day.
I know. I personally think that it's gonna go straight back into shortage. Now, whether the FDA declares it a shortage or not is another story. That's more
Mhm.
political, but there's clearly a massive shortage of tirzepatide still, even though they took it off the shortage list. So what do you think the biggest pitfalls are around weight loss and lipo? Like, what should people look out for as far as when they're looking? Obviously, anyone in Florida, they can go to you, but let's say everybody else and the rest of the country, what should they be looking for, not only in a doc, but also just in the program?
Yeah, so you definitely, for the surgery side, so liposuction,
Mm,
somebody that does a lot of liposuction,
hmm.
because you hear a lot of it has to be a board certified plastic surgeon. Nobody else can do liposuction. And then you think back to the history of liposuction, like a dermatologist invented the tumescent solution that you use, that everybody has to use so that you don't
Hmm.
bleed out during liposuction. But you want to make sure that they're posting before and afters that are close to your body type and similar to you, and they're getting the result that you want to have. Because at the end of the day, it's, past experience predicts future performance. And you want a surgeon that enjoys doing lipo and isn't just pushing you to other surgeries instead. So I see it a lot with, patients will come to my practice and they'll say, oh, well, I already had 5 consultations and they all want me to do a tummy tuck, but I don't want a tummy
Hmm.
tuck. I can't take 6 weeks off of work. I just want to get rid of my belly so that when I put a tight dress on, it lays flat. And, we have a surgeon at our practice that can do tummy tucks. I can just say, okay, fine, go to my partner and get your tummy tuck. But a surgeon that's going to listen to you with what you really want, not push the surgery that they want to do on you so that,
Hmm.
you have options. And then from the weight loss program side, somebody that's going to, it might not be the surgeon, maybe it's the nurse practitioner, the PA. Obviously, a lot of the mid levels are the ones running these kind of things. That there's some support when inevitably you're going to have side effects. You're going to have nausea, vomiting, like all the GI issues. It's going to happen. So
Well, I have
some
to
of the
say
like,
that's what in my practice or haven't been because tirzepatide has way fewer side effects. So it's not inevitable because I've managed to lose 20 pounds with no side effects. But anyway, just for
You
what
know,
that's worth.
it's funny you say that because my office manager hates tirzepatide and loves semaglutide. She says that tirzepatide is so strong that she can't take it because she gets too much nausea.
Well, I think that that's very, idiosyncratic to her. I would say that, all the studies have shown that tirzepatide has fewer side
Tirzepatide is
effects
better. Yes,
and
I
more
would
and more
agree.
weight loss. And also like dosing wise, if you're actually drawing it up yourself, you can choose whatever dose you want, right? The lowest dose that you can get officially if you're getting Zepbound is 2.5, which is very
Mhm.
low. But you can cut that in half too. Like if,
Which
you
is
know,
I tell the weight loss patients that too. I
yeah.
tell them inject twice a week and do, half and half instead of full
Or
thing once a
even
week
just once a week and half the dose. I mean,
and half the
everybody's
dose,
dose
right?
is different, but I do find that really interesting. I think that the GLP-1s are changing the planet. I think that they really are like the answer to a lot of people's prayers. There was just an article in the New York Times 2 days ago about doctors all over the country losing weight on the
Mhm.
GLP-1 agonists. And they interviewed all these cardiologists at a cardiology conference and they all looked amazing and they were all like slimmed
Oh.
down and fit. And I just think it's funny, when doctors are using it on themselves and it's working, that's a really big deal because most
Big shift,
doctors
yep.
don't take medicines at all. Like we just avoid them generally like the plague, right?
Oh, I'm the
So
worst patient.
yeah, we don't like to take medicines. I mean, doctors prescribe them all the time, but like we hate taking them. So I'm curious to know, I'm sure you've seen crazy complications walk in your door. So do you have any crazy stories about kind of lipo gone wrong or stuff that you've seen out there about liposuction?
Yeah, definitely. So we're really close to Miami, and Miami obviously is a hot spot for cosmetic surgery, like mommy makeover, like everything. And they advertise these crazy cheap prices, so like they'll undercut everybody on price. And they're doing more of a volume game, but
hmm
they offer absolutely zero post-op care. So if you ever have a
Mm.
problem, they will never see you again. And especially if you're traveling, I mean, my office is probably 2.5 hours from Miami. Let's say you have a seroma and it needs to be drained every 2 to 3 days until resolution, and you don't have anybody to do that for you. Are you going to drive to Miami to get it done? Is the person at that clinic going to be able to help you, or are they busy, doing their other 5 or 6 surgeries that day? So, yeah, I've seen it a lot in my practice where patients get, I've seen wound dehiscences that are
Ugh,
enormous, and I have to send those people to wound care, and I have to tell them, hey, I can't help you, I'm sorry, like your original surgeon in Miami isn't going to help you, I can't do anything for you. And it's just these patients, the med spa and cosmetic surgery patients, you're getting a procedure done to look better and feel better, so when something bad happens, they internalize it even more and they think, why did I do this to myself? And I've seen a lot of post surgery depression, even the patients
oh,
that don't have anything wrong with them. I had liposuction 2.5 years ago now. And I even felt that way. And I said, oh my God, I'm so uncomfortable. I feel bad. Like, why did I do this to myself? So when something bad happens, you think
right,
it 10 times more.
right. How long does it take to recover from lipo generally?
It depends on which of the symptoms you're talking about.
Mm.
So, feeling like you can go back to work in terms of a work from home or a desk job, 2 or 3 days, you're going to feel like you got punched in the area. You're not going to be doing jumping jacks, but you can sit at your computer and you can do your job. Full recovery, where you have, full feeling, it doesn't feel like lumpy or hard, 6 months to a year sometimes.
Wow. So a really long time, really, to get
It
back
can,
to
yes, the
super duper normal.
inflammation.
Yeah.
Yes.
And what are the main complications? I mean, I kind of know them, but explain the basic complications that can happen with lipo.
Yeah, 2 that I tend to see most often, and number 1 is seroma. So, you have to wear compression after
Can
liposuction.
you explain what a
Yeah,
seroma
so
is for
seroma
people?
is a fluid collection under the skin where basically your body walls off this fluid, because when you do liposuction, you're kinda creating a space between where the skin is and that muscle layer, and the body doesn't like holes, so it fills it with
Right.
fluid. And then that pocket of fluid, when you come to me in your post-op, it looks like a waterbed basically. You tap on it and it's like rippling. It feels like a lot of pressure on the inside. And then how you treat it, you have to take a needle, put it into the right space, create a vacuum, and basically drain all of that fluid out. If it's a very big seroma, it can actually take multiple times before the body will resolve it. And you have to do compression. So a lot of patients, they think that the post-op instructions are just there for fun, and they don't realize there's a
It's
reason
really
I put that.
important. Yeah.
Yes, there's a reason I
Because
gave you
with
that hard word.
seromas, you can end up with a chronic seroma where it stays there for a long
Yes,
period of
and
time
then
or
you need a
forever.
capsulectomy. Yes.
Yes. So, I mean, we used to see that post lumpectomy sometimes in the breast cancer world. Yeah. So you need to make sure you follow directions. And I think that the most important thing that you've said so far, from my point of view, is you absolutely have to go somewhere where you can get follow up care. Walking away and flying back to your city, 1,000 miles away means that if there's anything, and surgery, there's always something. Okay. Even
Yeah.
there's always, you have to be able to see your surgeon and make sure you're recovering properly and take care of that. Otherwise, you can end up with big time chronic problems. And for people to understand what that might look like is, if you take something out of the body and that's a space now and it fills up with fluid, from the outside of your body, you can't tell that something's been removed. So it's going to look similar, if the whole
Mhm.
area that you just took out is filled with fluid now. So, and it'll be jiggly. So, so really that doesn't look so good. So you absolutely have to be able to take care of these things. I think that extends to the rest of the med spa world too. There's actually a chapter in my book about this. There's this dermatologist, actually someone out on the East Coast, not far from you, who was dealing with a med spa complication, and the med spa stopped returning their calls, wouldn't even talk to the doctor trying to fix the med spa's complication. So you need to make sure that the person doing your procedure is going to take care of you,
Mhm.
right? It's not just a commodity that you're purchasing from a store and walking away. That's yeah. Anything else? Any other? What's the craziest thing you've seen walk into your office?
That I caused or somebody else caused?
No, well, anything. I mean, you
Because
can talk
I
about
just
your own
had one.
complications.
Speaking of seromas, the not the biggest seroma I've ever seen, but like longest lasting. And of course, something happens over the weekend when I'm out of town. And he ended up going to the ER, and he had to have drains placed by interventional radiology because he'd already been to my office probably 3 times at that point for me to do the manual drainage. And this seroma was just output like probably 100 cc's every 24 hours, which
Wow,
is a big
that's a lot.
seroma. Yeah, no, he had his drains in, with the vacuum for probably 2 weeks. And it was the kind of thing that I had never even seen such a big seroma before. And I've been
Mm,
doing this for 4 years now. The average seroma in my practice, at least in the abdomen, maybe you get 50 cc's, you drain it 2 times, and then it just goes away
and
on
that's
its
good.
own. So he was one of those cases where you start thinking back, you review the post-op instructions again. You say, did you wear your board? Did you wear your compression garment? Did you do this? Did you do that? And he told me that he had done everything perfectly. And I really, I couldn't pinpoint a reason on why this happened to him. And I guess what would change for my clinical practice in the future, since I'd already drained him 3 times, maybe be more aggressive with, when you're doing seroma management, you can do doxycycline to help scar down that pocket a little bit more.
Mm-hmm.
I could maybe look into getting, this is stuff that they put in the literature, buying talc for what you use
Mm-hmm.
for pleurodesis. But
Yeah.
when you're when you're in private practice, you start realizing that things are hard to get. Like
Oh,
it's not like when you're at the hospital.
yeah. Well,
And there's
nowadays they can be really hard to get in the hospital as well. There are weird shortages that affect everybody, including just saline, right? Like sometimes there's a saline shortage.
Oh, yeah, we've
Crazy.
dealt with the saline shortage at our practice because we go through a lot of saline with the
Yeah.
awake lipo.
Yeah. And we go through a lot just with Botox and Dysport. But, have you seen any post lipo infections?
Yeah, I've definitely seen infections. You know what I've seen more recently is Mycobacteria. And I hear
Mm-hmm.
about it a lot on, online, but I've probably seen 2 or 3 cases in my office where I went back, and the only thing that gets published in the literature is surgical instrument problems. But I think there is more coming from the environment than we honestly know, because I've cultured these and they weren't even the same kind. I've had them where it was like different surgeon, different rooms. We really dug into the epidemiology of these cases and we couldn't find a link. I read a report because when I had my first case, I was like, oh my God, what did I do wrong? And there was a surgeon, I think in Israel, and for I think it was 2 years, his breast augmentations were being infected with mycobacteria, and they had to shut down the practice. The Ministry of Health got involved. They did all this tests. They did everything. The water filtration system, they flushed the lines. They spent a lot of money on this. And you know what the culprit ended up being in that particular case?
What
The
was it?
surgeon was colonized, like his skin, from using his hot tub,
Oh my
and he
God.
had to use a special shampoo, and that got rid of all the
Oh my
cases.
God. So how, but wasn't he in full scrubs or do you
Yes,
not?
but eyebrow hairs,
Oh my
like,
gosh.
the case
Wow.
really di yeah, it was
That's
crazy.
crazy. Oh
Yes.
my gosh. That's
So
insane.
I
I mean,
think
so for our audience, Mycobacterium is a kind of infection that's just very, very, very difficult to get rid of. It tends to kind of wall itself off inside the body. It's really hard.
mhm,
So you can treat it, treat it, treat it. And there's one patient that I interviewed on the podcast. She got a rip roaring Mycobacterium infection because she went to an unlicensed spa and they had ordered fake Kybella from Alibaba that was
mhm.
contaminated with Mycobacterium. So got it all over her body. She's kind of scarred for life. She almost died. I'm kind of curious to know if you've had anything worse. There was one case when I was a resident, so this is a long time ago. There was one case post lipo, someone got necrotizing fasciitis and actually died in our hospital. I know that's super rare, but what do you think about when you hear?
Honestly, Kate, I that's the stuff you read in textbooks, but when you do awake lipo, you don't have problems. These patients, I think a lot of the risk honestly also comes related to the general anesthesia, where the blood clots, the more likely to get infections because the hypothermia, the shock to the body, all of those things. With awake lipo, I don't see problems. I've never had a patient that had to go emergently to a hospital because they were going to die from something related to their liposuction.
uh,
Not one time. And I looked at my case log the other day. I've done over 850 cases. No one.
Yeah. Well, it's interesting. I mean, that was also a long time ago too, and technology's changed a lot. And can you talk a little bit about the skin tightening that you do with Renuvion? I'm kind of curious about that because
Yeah, so
that's, more invasive kind of skin tightening
mhm.
than we do in the spa setting.
Yeah, so similar technology though, in med spa you talk a lot about radio frequency skin tightening. So Renuvion is actually also radio frequency skin tightening, but using plasma energy delivered internally. So how the device works, it basically gets to 80 degrees Celsius as soon as you turn it on. And then
Mm-hmm.
that's gonna target like the collagenous network around the fat globules. You know how I was saying it's not a milkshake, there's actually a lot of resistance to it.
Mm-hmm.
So it's targeting the resistance. And then I like to tell patients it's kind of like a controlled burn. So you're delivering heat to that tissue. And have you ever seen, when you're boving something, it kind of gets desiccated, but it also shrinks?
Yeah.
You're
Yeah.
doing the same thing when you're doing Renuvion internally.
Right. So what that is a device that goes underneath the skin and basically
Hmm.
tightens it by, I'm going to say the word coagulate, but really like for people who are non-medical, like just basically sort of scarring it underneath the
Hmm.
skin to tighten it. Right. Okay. And do you always do that at the same time as lipo or just in some people? Or do you do it after?
Probably more than 90% of patients. So, the steps to lipo are we numb the area, we do the lipo, we equalize everything, and then we do the skin tightening at the end of that. So it's in the same session, it's just
Hmm.
the last step.
Right. And it makes sense because if you're going to lose a lot of fat, chances are you're going to need some skin tightening. Otherwise, you'll look kind of floppy. and loose.
Yeah. So even with liposuction, if they have good skin quality, your skin is going to retract on its own, even if you don't do another device.
Hmm.
Renuvion is there to give it even more of an extra boost. And, some surgeons will say, well, absolutely not. You have to do a tummy tuck. You have to do an arm lift. Think about pregnancy. I had a baby 3 months ago. I was 70 pounds heavier and my stomach was like out to my knees practically. And
You had one baby or two or
I
more?
had one baby, but I
One
gained
baby,
70
70 pounds.
pounds. It's
Okay.
my third
I'll
baby.
see your, I was going to say, I had two babies, but I only gained, I think, 45 with the twins. So, I don't know. I feel like that's a special magical feat. I'm not really sure I did
Oh, I've always gained 50, 60, and this time was
with 70.
75. I was 226 pounds the day I gave birth to my
Oh
third
my
child.
God.
And I've already lost 55 pounds. Yeah.
Oh,
I
good
go
for
up and
you.
down like
That's
a
crazy.
lot.
Well, it's a good thing you're in the business that you're in. So tell me a little bit about Exert Body Sculpt. How did you decide to found that, and what are you trying to do with that?
Yeah, so like I said, after I started with that mentor of mine, I was focused on just the med spa side. I did weight loss, I did the injectables, and I actually started in a salon suite. And it's funny, I saw two of my patients today from back in that salon suite 4 years ago, and they're like, "Wow, look how far you've grown!" And we're doing construction on a 13,000 square foot building right now.
Gosh.
And yeah, how we got started, it just grew. So I was in that salon suite for I think 3 or 4 months, something like that. And the revenue kept jumping, and I obviously I had another day job too. And then we ended up purchasing the first building, which is where we are now, and it was about 1,000 square feet. And I, went back to my mentor's office a few times. She taught me how to do lipo. I got a little bit more confidence doing it with her, and then I went and bought all the equipment, and I started doing it, and I started putting myself out there. And it's kind of like doing this interview. You have to put yourself out there and let people know what you're doing, and they'll either be attracted to that or they won't. And you can't like worry about what other people are going to think, because then you'll never get started. But yeah,
That is
Exert
so
Body
true.
Sculpt, we've been around for about 4 years now. And our specialty, it's not just awake lipo, it's awake procedures in general. So my
Hmm.
partner, she'll do an awake breast lift with implants. She'll do an awake tummy tuck, awake arm lift, anything that requires less downtime, just a lot less risk for the patient. And you're less restricted on the age groups that you can do or even like medical history. Because sometimes, like I've had patients that have a history of multiple blood clots and they're on Xarelto and they're young and they want to get lipo, but nobody else is willing to do it with general anesthesia. So I tell them, hey, go get a medical clearance, go figure out, how we can manage your medications, and I'll take on a patient like that.
Hmm. Well, cool. That's really good to know. So I think one thing that I think is really true about what you just said is being genuine and being yourself and being really vulnerable. I think that that is really important in any practice and in any job, really. I think that people need to trust who they're talking to.
Mm-hmm.
And in no time ever in my life have I pretended to be a dermatologist or a plastic surgeon, or, I talk all about breast cancer because I really did that for a really
Mm-hmm.
long time in my career. And I think that if you're really knowledgeable and you're smart, people will trust you. It's not really about your path. And I think I was telling you earlier, I thought you really kind of dodged a bullet when you avoided dermatology accidentally, because even though you're so passionate for it, because, medical derm is way less interesting to me than
Oh,
cosmetic.
I would definitely agree. I
um,
I I love the aesthetic side. I still
yeah.
do. I had at least two sculpture patients today. I did lip filler. I did consults for lipo,
Yeah.
obviously, and I I like making people like feel better about themselves.
I think that I have a penchant for procedures and I love talking to people.
Hmm.
And I was doing that before in breast cancer and I'm doing that now. And it's all about what you're passionate about. So I think that that's just phenomenal. So is there any piece of advice that you would leave our listeners with about if they're interested in the whole realm of, lipo and weight loss? Like what would be your number one or one and two pieces of advice if they're interested in that?
I would say don't let fear stop you from taking on something new, because there's a lot of resources out there that you can take courses to figure out how to do liposuction, how to do procedures, how to implement a weight loss program into your practice. You just have to find the right mentors, not just somebody that's trying to sell you something, obviously. And then it's, you do this one day thing and then they're like, all right, well, now you're ready to do it. You're probably going to need a little more hand holding than that. But I think fear stops a lot of people from moving forward. And if I can do it, having heard my background and like how I got into this, I think that anybody can do it with the right support.
And what would you tell our audience members who are non-medical, who are really interested in getting these procedures for themselves?
I would say what I say to most of my patients, they wish that they had done it 5 or 10 years ago.
Mm-hmm.
After they're all said and done and healed up, they say, man, I look so much better. I feel so much better. What like stopped me from doing it to date? Was it again fear of the procedure? Was it fear of the downtime? Was it like stuff going on in your personal life that you felt like you couldn't take the time for yourself? I have so many patients that they say, man, I wish that I had done this sooner.
Yeah, I think that is really so true. I think I've had so many patients. It doesn't even matter what we're doing, whether it's Botox or even Sculptra or RF microneedling. God, that really wasn't bad, and I love it. And why didn't I do it sooner? So I totally agree. Well, Giselle, thanks so much for being on the podcast today. It's been really great speaking with you.
Great. Thank you so much for having me, Kate.
If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's DRKATEDEE.com. Or reach us through the website, medspamayhem.com. And read the book. MedSpa Mayhem is available everywhere books are sold. Thanks for listening. This has been MedSpa Mayhem with Dr. Kate Dee. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. MedSpa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspamayhem.com.